front lines of the COVID-19 response have been men and women from different walks of life. We have most of the time talked about the doctors who have been at the front lines, those who've put their lives at risk to make sure that you and I do not contract the coronavirus, or even when we get infected, we are able to fight it. One of those doctors is Dr. Jemima Kariuki. Dr. Jemima is a medical doctor and currently a resident at the University of Nairobi Kenyatta National Hospital, pursuing her master's in obstetrics and gynecology. She came up with the Wheels for Life, a link for pregnant mothers and healthcare services during curfew hours. Dr. Jemima was one of the Uzalendo awardees, conferred the national honors, the Presidential Order of Services. Congratulations, Daktari, for these honors. Now, why did you come up with the Wheels for Life? What was happening that inspired you to actually think about this novel idea?
Wheels for Life, the idea behind Wheels for Life came actually from a tweet. So while walking in the corridors of the hospital, I realized that we had very many poor fetal outcomes that were coming due to late referrals, especially at the beginning of the curfew. And we noticed a drastic reduction in the number of patients that we were seeing. And then we now noted that we were having poor fetal outcomes.
These are children being born?
Children being born who are not doing so well, who need some resuscitative measures or just help to be able to actually cope with life in the first few minutes. And that was a concern. Then when I was going again to social media, I encountered a tweet from a fellow doctor in Kitui County who was also sharing about how he had seen poor maternal outcomes with retained placenta, which is what should come out after the baby is born. And it would remain there for 5 hours. Ideally, within 10 to 20 minutes, it should be out. Yeah? And severe bleeding, a woman having bled for over 7 hours waiting to come to hospital to be checked. And of course, a rise in home deliveries that were unsupervised. So having noted all this, I think for me, what tipped everything was actually a feature that showed a woman who had bled out during childbirth alone at home, and while the baby survived, she actually succumbed. So it really, really bugged me, and I felt like I needed to do something, or as a medical fraternity, we needed to do something. And that something became, if you have anything, if you're in labor at night, kindly reach out. And the thought process behind it was that if at least they had guidance and they know that this is what ought to be done, then they can be ready earlier. That was my first thought process. The second was that I could be able to connect them from their homes to the hospital. And so Wheels for Life has now evolved from that idea, and now it incorporates taxi services from Bolt, ambulances from Rescue, and a call center where now everything is free for the woman, where you get a free call to the call center, and then you get your ambulance if it's emergent for free. If it's an urgent need, they get a taxi for free. And they also get free doctor consultations once they actually access the number. And yeah, so the whole thought process was there was a drastic need to be able to get to our women and help them during that time to access the hospital.
And so what is the process for a woman who may be in need? And now we know the curfew is between 9 and 4 a.m. What is the process for a woman? Where do they call? Who do they reach out? Is it countrywide, or is it just limited to the city? What is the process like? So
the process of gaining help from Wheels for Life is actually quite simple. We've been working from 7 to 5. That won't change, because we noted that many mothers are actually waiting for that time to call, which is saddening, but we need to do our bit as Kenyans and as the doctors on the front line. So the patient or the woman would call 1196, would call 1196, whether the neighbor, whether the husband, whether the patient themselves. And once they call 1196, they just need to talk to the call center person and tell them that they need help from the doctor, and they will be directly transferred to a doctor. And so the doctor who's on call that particular night will listen, triage, advise, and see the need. So again, if it's a consultative kind of thing where it might be false labor from whatever they're talking about, or it could be an infection from whatever they're describing, and while also trying to follow the guidelines and protocols of maternal health care, we would now dispatch either a taxi, we'd dispatch an ambulance, or we'd advise what the woman should do in the meantime as we wait to see if they're okay or not. So basically that's it. And then we have now, from the other end, we have our Bolt riders who will pick up the call from the doctor, because the doctor will dispatch. So they'll pick up the call from the doctor and we'll be able to link them that this particular patient is in this area. And so they're able to go and actually get the patient and report back to the doctor once they reach the hospital. And the ambulance service as well. We call the ambulance and we tell them this patient is in such and such a place, and this is the state, and this is what we have assessed. And they're able to quickly get there under 10 minutes, get the patient, get them to the hospital, and also give our feedback on how we're going.
Okay. So since you started the 1196 toll-free number, how many calls have you seen since then?
Wow, we've had over 4,000 calls actually from different people who really just want to find out, is this working? What can I do? What can I?
Yeah, I'm always ever so curious.
You know, so, but the ones that have actually been referred to the doctors are actually over 430 by now, by yesterday. They should be around 430. And of 70% of those ones have either accessed either a cab or the ambulance system, and then the other 20 to 30% would be either antenatal advice. And from there, we've seen about 300 children who have been born successfully, and we're happy. We're really, really happy as an initiative.
So do you think in overall, looking at the program, it has changed the initial thing that you were seeing, where you're seeing bad outcomes of the children being delivered, or mothers are actually losing their lives? Are you seeing a difference?
Significantly, because whenever a woman calls, and you can pick even from just listening that they're in the last hour before delivery, and you send that ambulance, sometimes they deliver on the road, you know, and you get there in the ambulance and you're now, okay, now do this, and you're giving instructions
to do the final delivery.
Yeah, so that by the time you get there, you're now taking the woman and the placenta out and taking them to make sure that everything is okay. And we're seeing cases where someone tells I've been laboring for 2-3 days and I don't have money. It's even if it was not for this toll-free, I wouldn't have been able to access, and you're able to actually help them. And on the other caveat is being in the hospital, I note some people who have not had access to this particular call service, and women coming in with such extensive tears, and they're telling you, I labored for 2-3 days and I lost my baby, you know, and it's really heartbreaking as a doctor or as a human being to say that.
Okay, so because what Wheels of Life addresses is something that I think maybe as a country we should address, and I'd like to pick your mind on this, is the need for ambulance services, reliable ambulance services, and the need for a reliable emergency line. When COVID started, the Ministry of the Government set up the 719, and then there have been so many other lines. I don't know what you think about, is it time that as a country we start thinking about some of these things seriously? Because in a pandemic like this, in an emergency like this, then there are those people who actually pay with their lives.
I know that, and it's so sad. So I think as a country, it's high time. It's actually high time. All other nations, especially abroad, we see that they have quite well established emergency setups. And I think as a nation, we should be able to use telemedicine, you know, and any patient, not just maternal health care, but any patient should be able to know, if I call this number, I am able to gain help, and at this is the dispatch time I'm anticipating, you know. And we should not be worrying about, now we are sick, now where are we looking for funding to leave? Now we are sick, motorbike ya neighbor imepotea, you know, such things. And it's so,
the boda guy
does not want to risk their life, you know.
Harassed on the way to the hospital.
So, and in the beginning, that's actually what you were saying. It was actually a lot of convincing, even for our drivers, that this is something that we've given you letters and you're safe, and you know, so that they could gain that confidence to get to the road. But that said, I think as a country, plus or minus COVID, plus or minus curfew hours, we need to have an established system for maternal health care and for even all other issues, yeah. And having said that, if we know that we have free antenatal care, and I'll speak like that because I'm an obstetrician at heart. Yeah. So if we know we have free antenatal care with the provision of Linda Mama, for instance, and we know we have free delivery, again using the provision of Linda Mama, yeah, then why don't we have free access to the hospital? Yeah. So that if you've given me free healthcare, but on that day I don't have 100 shillings, how am I going to get to that facility? You know, and it was sad because initially we'd see women walk over 15 kilometers in Nairobi, you know, and that's a metropolis. And so it's really something that we should, as a country, actually go into, and not just for Nairobi, which is where we're restrained for now because of resources, but it should be in Bomet, it should be in Western, it should be everywhere. You know, that our women know that if I call this particular number, I am going to talk to professional, skilled health workers, and I'm going to get to my hospital or wherever it is at, whatever help that I need at that particular point in time. And it needs to disseminate from maternal health care to other systems, you know, and it needs to disseminate from the metropolis to other counties.
To the entire country, actually. So what do you see the 1196 or the Wheels for Life changing into or growing into, if at all?
If we can fill that gap, that one, that we can be the ones to provide that service, because we're already in it. We're already establishing how to do this, have the flow, the whole process of it. And we've already met the challenges and we've started having to cater to them. So if you could do that, not just for women in Nairobi, but for women in Kiambu, Machakos, Kitui, like I feel like this would have really benefited Kenyans. Yeah. Okay,
and hopefully we will not reverse the gains that we have made so far in maternal and child health care in the country. Thank you so much, Dr. Thank you for your time and keep up the good work. Dr. Jemima Kariuki, who is a resident in obstetrics and gynecology at the University of Nairobi at the Kenyatta National Hospital, who set up Wheels for Life and was awarded the Uzalendo Award, conferred the national honors by President Uhuru Kenyatta during this Madaraka Day. On the COVID front lines, the men and women who have put their lives on the line to make sure that healthcare services continue being provided and services related to the coronavirus continue being offered, the risks notwithstanding. I'm Dr. Mercy Korir. Keep safe, stay home, and observe all the measures that the Ministry of Health has put through to keep safe from the coronavirus.